cow's caught, we would go ahead and vaccinate her so we didn't have to back her up and bring another one in. So this handout that I put together is kind of a summary of vaccinations that cows need in Kentucky. And it goes through different ages, different stages. So what I thought we'd do is kind of look at this and see how it works. And this is a little introductory paragraph. It is one of the most common questions I get. What vaccines are necessary yearly? And so the guidelines I've set forth are recommendations for Kentucky, because a lot of times what we see are vaccination programs for other states or for other types of producers. And vaccines have changed a lot over the years. They've gotten better. They work better. They work longer. And so we need to pay very close attention to the labels on vaccines now, because they do change. And as I say, they are much better. So Arch I think has gone to, there you are.
Charlie.
He's getting
Charlie went to get,
okay.
I'll wash my needles.
So when do you turn the bulls out? Or have you turned the bulls
I
out?
have not turned the bull out yet.
Okay, when will you? With the cows?
Coming up shortly, here about the 1st of May.
About 1st of May. And this
Just don't
is,
say you leave him out year round, you'll be alright.
so he's about a month, right? He's a month ahead of breeding. And that's about when you want to start thinking you need to vaccinate. You want to get in here and vaccinate, again, cows and bulls 4 to 6 weeks prior to breeding. That's where you want to start. Timing's very important. Timing is exceptionally important because most of the problems we have are early in pregnancy. So you want to have them at the maximum amount of antibodies, which is what a vaccine does. You want that to be at peak early on. So that's why timing is very important. So number 1 there, she'll get a viral respiratory vaccine. Let me grab that vaccine right here. He's using ViraShield. ViraShield 6 plus BL5. Anybody else use that? You know if it's killed or modified live? It's killed. Killed vaccine. We got 2 different types of vaccine. If Arch wanted to use modified live, he's still about a month ahead. He could, because he doesn't run the bull with the cows. So it's okay. He could go ahead and use a modified live in this cow and she'd be fine. If you ran the bull year round, or he had, or if this cow was pregnant and had never seen a modified live vaccine, and he gave her one, then she could abort. So you gotta be careful. You gotta know what you're doing when you use modified live vaccine. Talk to your vet before you use it.
Will you know what say on the bottle?
Yeah, it does. Now, and it'll always say on there, modified live, do not use in pregnant cattle unless she had a dose of it before she was ever bred. So it's very, very specific instructions. So we're going to give her this ViraShield 6 plus BL5. The numbers will mess you up when you think we drew ViraShield 6, and I thought she said it was a 5-way respiratory. Well, it is. It's a 5-way respiratory vaccine, but it actually only covers 4 viruses. So we got lots of numbers in there. IBR, BVD, PI3, BRSV, 4 viruses. Sometimes they'll cut BVD 2 ways, and sometimes they cut it 3 ways, and that's where you get that difference in number. So ViraShield 6 is going to be your respiratory part of that vaccine. Then it says plus VL5. Anybody know what's the V stand for? Not vampire. What's V stand for? V is for Vibrio. So that's one that they need. They've got to have Vibrio. How about the L5? Anybody know what L5 stands for? 5 strains of lepto. So you got everything in there. Now, let me show you this. He's also got this for his calves. Looks very similar. When you look at those two bottles, if you're not looking at them closely, you're going to easily grab the wrong one. This one's ViraShield 6. He's going to give that to his calves. Doesn't have the VL5 in there. So if you give this to your cow, she's missing it. She's gonna miss that VL5 portion. So make sure you've got bottles that are very similar but just a little bit different color, read them. Because they're generally two different vaccines, and I've made this mistake myself. That's why I emphasize it. All right. So what else would this cow need? Well, she need a blackleg shot. How old's this cow?
What number is she?
I don't know.
Yes, she needs it.
18.
18.
She's 5 years old.
5 years old. And how many blackleg shots has she had in her lifetime?
I would have to go back to my records, as you know, but she has had them.
Yeah, I'm sure she probably has, and a majority of herds will give blackleg to the young calves, revaccinate at yearling when they're yearling stage, and then usually again about the time they're 2 years old, and after that they stop. And that's okay. You can do that. Unless you're in a very high risk area for blackleg, you're all right. That vaccine lasts a long time. And when I say high risk, who's at high risk for blackleg?
We are. We've got deer and elk.
Of course, the blackleg organism's a spore, so it's in the soil. Where you're most at risk actually depends on how much dirt is changing over, moving over. If you got a lot of bare dirt or you're moving dirt quite a bit, you're gonna pull those spores up when they come back up. And those are high risk areas. There are certain fields, I can promise you that there were, when I was in practice, there were certain fields when somebody put their cattle out there, I knew they were gonna get blackleg. It happened every year. It happened every year. I could count on it. Because that field had lots of spores in it. So if you know you got a high risk area, you know you've had blackleg on your place before, vaccinate your adult cows every year. It's not going to hurt anything. It's not going to hurt anything other than she's going to have a lot more knots on her neck.
It's a very cheap vaccine.
It's cheap. The only thing about it is it does not most of the time. And that's just the way the vaccine's made. So, blackleg plus or minus, depending on how you feel about it. If you're at risk, use it. It's cheap. All right. How about deworming? You've got a dewormer.
It's over there on the right-hand side.
What do we got here? All right. He's got a dewormer here. Anybody ever use that Decamax injectable? I like the fact that it's branded. It's a branded, or what they call a Pioneer product, which means it's not generic. And what we found, the latest research is on these dewormers, if you use generic Poron ivermectin, all you're doing is treating them for flies. You're treating them for flies, you're treating them for lice. You're getting all your external parasites, but as far as Poron ivermectin, the cheap stuff, it's not getting your internals any longer. You're resistant to it. Every study is the same way. They're all resistant to that internal. So if you're going to use that cheap Poron ivermectin, use something else with it at the same time to take care of your internal parasites. So some of the good old drench wormers, the white wormers, Safeguard, Valbazin, Synanthic, those are really good choices to use with the Poron. So these branded products like Dectamax, Ivomec, Epernex, what am I leaving out? Where are you, Les?
Right here?
Sidectin, that's the one. You're supposed to chime in there when I leave something out.
I didn't know if
You
that
weren't
was-
even paying
I didn't
attention.
know if that was a dramatic. That was dramatic. Oh,
All
you're
right,
asking a question.
so we got Sidectin, Dectamax, Ivomec, Epernex. of those are called insecticides. They take care of both internal and external parasites same time. That's why they're so valuable. That's why everybody really likes them. They also give a lot of residual action. You can give a shot of this, and it usually will tell you on the bottle how long it lasts. And it just depends which parasite. Most of the time it'll give you around 3 weeks of coverage with one dose. And that's in contrast to like if you use one of those drench wormers, like Safeguard, it works one day. It works the day you give it. You don't have any residual activity. All right. Any questions on dewormers? I always get asked which is better, injectable or pour-on. And it has been shown, research has shown that the injectables are better, only because you get a higher blood level. Versus the pour-ons, the absorption can be different from cow to cow, and it's not nearly as dependable. So, injectable is better, but pour-on certainly is easier. And don't feel like you have to use an injectable, but it may be something you want to consider to throw in sometimes. So we're going to deworm her in the spring. Will she need deworming again? Will you deworm her again this year?
Probably.
When do you usually do it again?
We'll do it in about 60 to 90 days.
Right, so you'll be in the summertime, right? And that's a good plan. You're doing it in the spring. Right here's grass is growing. You know how to know if there's parasites in the pasture? If the grass is growing. That's the perfect weather for parasites. They like it moist. They like it warm. Grass is growing, you've got parasite larvae out in the pasture. So we'll do her in the spring, get her cleaned out, and then do her again in the summertime when things are getting dry outside. And that'll clean her out again, and there won't be a lot of larvae out in the pasture. So that's a good plan there. All right, how about tagging? She's got a tag in, right?
Yep.
Yep, she's got a tag for identification. And then, of course, I got here on the end, the breeding soundness exam is recommended for herd bulls. But the bulls get all this stuff too. They get a shot, they get the virus shield, they get dewormed, just like the cows do. So we'll go ahead and do her. Did you get the? Yes.
What's up?
Let's see what the virus shield says on there. Where did I put it? There it is. Hiding behind me. Alright, so the directions on the virus shield: shake well, administer 5 cc sub-Q 2 to 4 weeks before breeding is what this one says. And all the directions are going to be a little bit different. And then it says, give it under the skin and the neck, revaccinate in 4 to 5 weeks, and then revaccinate annually. So she's probably already had a booster at some point. So this is her annual revac. I think this needs to be fine. So make sure you shake any of these white vaccines especially. You need to shake those well. You got another needle?
No good?
No, I usually don't go in through the rubber and then go into the cow. I like that. Alright, she gets 5 cc's under the skin. Is everybody familiar with how to do this? Anybody need it up close and personal? You know where you temp the skin? Under like that. Of course, you've got the area of the neck here where you want to keep your injections, right in here in front of the shoulder blade. And then she will also get, is this set, Arch, where'd it go?
Yes. What do you get?
Is it already set for her? Or do you have to? I should've.
You're the calculator.
I know it.
How much does she get for that?
By the time he
I
gets
think
his
it's one
license on
sixty
and
for
all.
110,
That's correct.
right?
What's that come out to?
That comes out to what?
11.
11-ish. Dectomax will be under the skin, I think. 1 cc per 110 pounds, sub-Q or IM in the neck region. I'll give this one over here. I like to.
Yeah, she's, I think. He's gonna get the best two he had.
Yeah. That one was,
Hold on a second. Alright, is that all you want to do with her? Is that all you need? What else did she get? What
what
else?
are you giving her? Just that?
You're gonna give her, that's his calves. You're gonna give her,
Give her a fly tag while you got her here.
Give her
you gonna
everybody.
do fly tags too?
Nope, not yet.
Okay, not yet. So you're gonna do black leg on her and the pole?
What you gotta get?
While she was
Huh?
You get that, that's for the calf.
Right, that's for the calf, and the virus shield's for the calf.
You give her this, you give her the 6L?
I give her the 6.
Alright, you already gave her that.
Yep.
She getting,
You giving her a black leg too? What? Yeah. Okay.
you didn't pour it, you didn't do any pour on her, did you?
No. You're using, but you don't really need to. But you can. Yeah. Like I said, the Dectomax. Yeah, you're right. It really-
Takes a while to get up there.
What's your address down here? Indeed.
5 mil.
1 something, Prairie Park Lane. Forgot the number.
9:30, I believe.
41701, I
You
believe.
got the zip right, didn't you?
All right, so he elected to give the cow a blackleg shot too.
You got the best cow I ever saw to work
Is she
with.
good?
Yeah, they used to in Charlotte, I'm telling you.
All right, that everything
I
good?
just wonder how long Arch had to go out there and work to find that.
Sort of.
They did a little bit of tractor line to go another in there.
Yeah.
Hammer down. Get out in the dark, but not last night.
It wasn't last night.
That's right.